right now on Fox 35 News at 10.
New at 10, a local soccer player gets sidelined by an injury and a rare condition.
Right. Her dreams of playing professionally are dashed until one doctor performs a game-changing surgery. Fox 35's Keith Burgess reports.
Watching Natasha Merangoli run drills.
Playing soccer just set your mind free.
You wouldn't guess 2 years ago, doctors said she'd never play soccer again.
Devastating that I couldn't play the sport that I played for years.
In December of 2012, she hurt her ankle and didn't think much of it, though she was playing and living in constant pain.
It felt like someone stabbing me from the inside of my foot out.
That stabbing feeling was her bone dying, a condition called avascular necrosis, where the bone can't get enough blood flow.
Problem with the avascular necrosis when the bone dies is it can collapse, and then you get a very rapid secondary degeneration. The most common cause is from trauma, but oftentimes people who are especially athletes, they experience aches and pains all the time, and so they just think it's going to get better, and it just doesn't.
After a few months of not getting better, several doctors told Natasha her only option was ankle fusion surgery and to pick a new sport. Then she met Dr. Dennis Locks, who said he could save her ankle and her soccer career with her own stem cells.
Stem cells they home to areas of injury.
Dr. Locks showed us how he harvested stem cells from Natasha's abdomen and injected them directly into her ankle.
Stem cells are basically cells in the body that can become other types of cells,
transforming into cartilage and bone, bringing the dead bone back to life.
The one stem cell injection right here, and she basically recovered.
Yes.
In just under 6 months, Natasha was back on the field.
Some days I forget which foot it was because I don't feel anything anymore.
5, 6, 7, 8, 9, 10, 11, 12.
Her dreams of playing pro soccer back on track. With 23 goals this past season as a freshman, she was the top scorer on Boone High School's varsity girls team.
It was very rewarding to see that you gave somebody an alternate destiny, and it was a destiny that she wanted, which was to continue to play soccer.
I'm Kate Burgess, Fox
Standout high school athlete with the hopes of a collegiate scholarship, but then an injury. While heartbreaking for athletes, our next guest, Natasha Merangoli, may have been injured, but she's back out there playing. That's because of Dr. Locks and Sports and Regenerative Medicine Centers. Thank you both so much for coming in today. I gotta say, I love Natasha's story here, Dr. Locks, and this is only one example of all the different people you treat with stem cells.
Well, thank you.
Talk about the process, talk about what you're able to do and how you're able to help people like Natasha get back out there.
Well, Natasha had a problem called avascular necrosis, which is the blood flow to the bone is disrupted usually after an injury, and a portion of the bone dies. So you have a necrotic dead part of the bone, and traditional medicine in the past hasn't known what to do with it. So they end up replacing a hip, if it's a hip joint or a knee. In her case, it was her ankle, so they wanted to fuse her ankle. And these aren't good options for younger patients to have fusions or joint replacements because they'll wear out. But obviously in Natasha's case at 14, fusing her ankle, she's never going to play soccer again, and you don't wear high heels. So the surgeons don't look at the things as a human being, which are quite important. So I've had a lot of avascular necrosis patients from around the world, so I have a lot of experience with treating it.
I will say, Natasha, getting that diagnosis, hearing what was wrong with your ankle, I mean, I'm assuming that you thought that your playing days were possibly over.
Yeah, all the doctors that I talked to said the same thing, that I had to get ankle fusion surgery and that I wouldn't be able to play soccer again.
So talk about getting treated from Dr. Locks. What was the process like for you as a patient?
It was scary because being 14 years old.
Well, yeah, I would say it was scary.
14 years old, it was completely scary.
But she did very well.
I was going to say, but I know there's a big but coming.
Yeah. Athletes typically are very stoic and there wasn't much of a peep out of her. She did well.
And so obviously a lot better than being able to fuse your ankle, correct? And being able to get out there and play again. When did you start noticing, like, hey, I'm going to be able to get back out on that soccer field?
Right before freshman year soccer season.
And I might want to point out, too, you also did end up getting that scholarship, right?
Yes, I did. I did.
And I'd like to point out, as we were saying, how simple it was. She walked out of my office. There's no crutches. There's no pain pills. There's no downtime. She walked in, walked out. So it is simple.
And I'm curious, if the bone was dead, as you put it earlier, how is it that stem cells were able to kind of awaken that bone and make it come alive again, for lack of a better term?
Well, stem cells are very sophisticated cells, and they can do a lot of things. They have surface receptors that read environments, and they're very sophisticated. One of the things they can do is suppress inflammatory reactions, and in arthritis, they read the chemical signals and stop the signals that are breaking it down, which is one of the great tragedies of avascular necrosis. Is the bone crumbles and the joint becomes rapidly arthritic, so you want to stop that. And then stem cells are also capable of differentiating, turning into a new cell type, so they can replace a dead bone cell with a new bone cell. That is harder in avascular necrosis. You need to have them early on, and a good patient who's younger does a lot better because they have great stem cells. So there's a lot of factors that go into this, and because I've treated so many patients from around the world, they're not all the same, but my expertise helps in this regard. But I do believe we caught her early. She's young, she's in great health, and so all the factors were there for her to do well. And her x-rays are one of the most fascinating cases. That her MRI showed a clear portion of dead bone, and then progressively over the years with repeat MRIs, the latest one this year was read as completely normal.
Well, doctor, you've mentioned too, you treat all sorts of patients, not just athletes. So I think that's very important to point out there. And so if you want more information on what Dr. Locks, how he can probably help you, well, go ahead and visit his website, give him a call. You can get a consultation from him. And again, he treats everybody as individuals to find out your best needs. Thank you again so much for your time.
Thank you.
Thank you.